so I'm going to call the meeting to order since Kathy is not here. And Terry has, well, all three of these have other obligations at 4. So it has been suggested that we move the action items up to the top. Does anybody have a problem with that? No? Okay. So do I have a motion?
Madam Chair, or Vice Chair, I move that we approve the agenda, moving items 8, 9, and 10 to follow item number 3, and then retain the order following that.
Do I have a second?
Second.
All those in favor?
Aye.
Okay. So approval of the minutes?
Madam Chair, I move the approval of the September 26th meeting minutes.
Second.
All those in favor?
Aye.
Passes. Okay, so the next one will be mutual aid agreement between the tribes. So Dave's not here. Does anyone want to speak to that?
Thank you.
Okay.
Sorry. Organize what I'll say. Okay, so this is a mutual aid agreement for tribes and local health jurisdictions in Washington State. Each government must make its own decision whether to sign into the agreement. 4 tribes and 3 counties have already informed the commission they approve of the attached agreement, and that has increased. But I don't know if she's been out of town or what, but I've been emailing for weeks and can't get the latest update. But on Friday, my emergency preparedness meeting, I heard we were the only county in our region that hadn't signed yet. And I said, dang, we were the first county that said we would. So anyway, I heard everybody else has signed of our region counties. So noting that, let's see, I'm going to find this part. Okay, so what this is and what they've been clear about is, please note that the parties who sign this agreement are under no obligation to provide aid to any other signed party to the agreement. So this isn't any kind of commitment to anything. It's just the tribes wanted to have an agreement with LHJs to share. And frankly, when it gets down to certain emergency preparedness things, they actually have access into the federal government for emergency preparedness much faster than we do as local government and even the state. Plus, and they have lower thresholds of which they can call an emergency. So it was thought from LHJs that was a good thing for the LHJs to get help and to be able to work. You also aren't working necessarily with your local tribes. You're literally crossing the entire state working with any tribe. So it's not just a regional thing, even though they focused on regions to get it signed and to educate people. But the reality is any region can have any region in this, or any county, or any tribe in any state with this.
So we are signing this agreement with all tribes in the state of Washington that are participating?
All tribes that sign.
That are participating.
Same with LHJs. All
Got it.
LHJs that
Okay.
sign, correct. Okay, I would do it. So that's basically what it is. Sorry about the big book that came with it. I hit the play button for the agenda, and it was like, oh my goodness. So this is something that we as Emergency Preparedness and our Department of Emergency Management and Dr. Yu would be working together on in the event we had some very large-scale event here that we wanted to work with the tribes on. And the tribes were the ones that instigated this. They didn't want this. And there used to be an agreement, I don't know years ago, but I guess it came out in the meetings that happened for the last year about it was that some tribes signed, some didn't, some make their own, and so the American Indian Council decided they wanted to do something statewide rather than standardized. So that's what it's
Okay.
about.
Okay. And this is for emergency as well as non-emergency, like the communicable disease type
It can
work?
be any kind of thing that we consider a public health emergency.
So it is emergency.
It is
going into-
emergency.
Okay.
Mhm. But it could be something as simple as combining, there's a great outbreak that maybe not be beyond our county, but we want help and we want to see if the tribes want to join us and help. Or vice versa, they have something going on in their tribe and they're asking for help with resources. So.
And there's the
And I
entire,
guess it's so large because, of course, it goes into the detail of legally. I And all the lawyers, by the way, Tim Whitehead has reviewed this, and he did this with Dave before he agreed to sign, so.
So we are authorizing the community services director to sign? Or
Well,
are we signing?
that was kind of strange, because I asked that question this last Friday as well, and they said they're having their Board of Health sign. Because I thought that there's 2 agreements that need to be signed. And I thought that the commission,
Okay.
that you would authorize Dave to sign, but then they said, well, they just suggested the chair
Oh,
of the
thank
board
you.
sign the 9-page one, and then the resolution be signed by all the board members.
Got it.
But that's how you wanted to do it. They only asked for the chair, but I was instructed that normally you guys all sign the
Yes,
resolution. so.
we do.
That wasn't in our documentation.
So, there it is if you want it first.
Thank you. Did you gentlemen have any questions?
I do not.
Madam Chair, I would make a motion that the Board of Health sign the resolution, Schedule B, Public Health Jurisdiction Resolution authorizing execution of the mutual aid agreement for tribes and local health jurisdictions in Washington State.
Second.
Any other discussion? All those in favor? Oh,
I'd love to hear a report back if this is utilized.
Oh,
In a non-emergency
Yeah.
basis,
Yeah.
situation. Emergency, I'm sure we'll know.
Yes. I'll definitely let you know.
yes. So, all those in favor?
Aye.
Okay. So, moving on to the meeting schedule. And I think you all got that in your packet. And have set dates of January 23rd, March 27th, May 22nd, July 24th, September 25th, and November 27th of next year.
Did anybody check when Thanksgiving is next
I
year?
did, it's the 22nd.
Okay, so this works out just fine.
Was this meeting this?
It was a change. Originally, it was supposed to be the 28th, and for some reason, it got changed, and
that
I
this one?
honestly don't remember what that reason
Or is
was.
that a different one?
Does it threw us all off?
Oh, no.
Yeah, I
I
know.
haven't
It
approved
really
that
don't
yet.
feel as much.
Yeah, yeah.
Except for that one, I think
And
it's
it-
just one signature.
Just,
Is that?
just
There
the-
was there was an ordinance in there, wasn't
There's a resolution.
Yeah.
A resolution. And there's a
Yeah.
resolution for the,
There it is, okay.
the,
Okay.
There should be 2 documents.
Proceedings, so this is the minutes. That's the minutes.
yeah.
If she put this one in the middle of the table, we could make this the official copy.
That's for you.
Yeah.
Here's the resolution right here.
Oh, you found, okay.
Yeah.
Good.
Okay. Anybody have any concerns about the proposed schedule for next year? This is all getting confusing. If not, Madam Chair, I would make the motion to approve the resolution setting the 2018 Mason County Board of Health meeting schedule.
Do I have a second?
Second.
All those in favor?
Aye.
Aye.
Okay.
There's that one.
Then we also, maybe, I don't know, do we want to do the new board member action? There was a little bit of a problem with that when she sent her letter to us, in that I noticed on the letter that she said she would love to attend our meeting on the 28th.
Ah,
Oh, yeah.
And I bet Dave didn't tell her any different. So I'm thinking that's why she's not here, but did anyone besides me read her letter of recommendation? She's on the school board, and we were trying to get other members such as that. So what is your opinion, I guess?
we had a short discussion at a briefing with
Okay.
Dave Wyndham, and he thought it was a good
It looked like a good fit to me,
a
but,
good fit, and because we hadn't yet heard back from the Fire Commission Association
well, I
about
think he sent
continuing-
out letters to both and thinking that we would get more than one.
Oh, okay, okay. I didn't know
Yeah.
if we were going to have just
Yeah.
one. Did we already change the bylaws or whatever the resolution that sets?
How,
Who
who,
is on it? I
I
feel like
thought
we
we
did.
did
Yeah,
change
okay.
that.
We did do
Yeah.
that, okay. So it's, I don't know, gentlemen, do you have an issue with appointing her, or would you like to
I do not.
have her visit? You want to make a motion?
Let me get her name again. Madam Chair, I move that we appoint Carrie Davidson to the Board of Health.
Second.
Any further discussion? All those in favor?
Aye.
Aye.
Aye. Okay. So there's all the action items.
Wow, we cruised right through those. Good job.
Make a note to do this more often.
So, health officers report. Diane is not here.
Confusion about the date?
And administration report. Do you want to do that for Dave or
Well, I think he pretty much
Yeah.
covered it
in his, yeah.
We had an absolutely wonderful time at the Washington State Public Health Association presentation. People were interested. We had a full room. They searched us out afterwards at the conference and wanted contact information and wanted to talk about ideas. Tacoma Pierce said, "Do you think this would work for us?" So it was really a good presentation, a good response, and a lot of interest around the state. So I think Dave's been working on some of the Foundational Public Health Services stuff. Liddy and I sat on a webinar yesterday afternoon about a survey tool they'll be sending out. And we will be doing that sometime in the next few weeks. And I think that's probably the kind of the top things for Dave's report.
So you want to go right into yours?
Sure. We're, I kind of did this like an end of the year report. Not quite the family Christmas letter I wrote a few years ago, but talked a little bit about what everybody's doing for the department and for their programs. We are really gearing up for new water quality work to start after the first of the year, the Hammersley Inlet project. We had a meeting last week down at the Shelton Civic Center. Oh, I had invited the commissioners at briefing, very short notice, sorry. But there were 109 chairs we ended up sitting up for that meeting. The State Department of Health said, yeah, write it up as 109 attendees, because there were a few empty chairs here and there, but there were people standing along the back that didn't want a chair. It was amazing. Bill Taylor called Scott Burbles from the State Department of Health on his way home and said, I was amazed at how well that meeting went. So every now and then, something works out. It was great. The State Department of Health talked.
About what? I mean, can you get a little more detail?
I'm sorry, about the concerns we had with the norovirus in Hammersley Inlet, and that was Lawrence Sullivan, who has been in and talked to the commissioners before. So he set it up with the concerns, the history, how many norovirus outbreaks we had in a very prolific shellfish growing area. Then Mark Toy from the State Department of Health talked about the dye test of the Shelton sewage treatment plant, which will be starting December 1st and going through December 4th. And he also talked about the water in Hammersley Inlet. Now, I know that water really cooks through there. It is something like 4 knots or something, which is pretty fast. But it sloshes back and forth for about 4 days before it changes over. So I learned something that I didn't know. Like I know everything, but that was something that was really an eye-opener for a lot of people in the room. We talked about how we were going to get all the information out to people, and we're using our website. Ben's going to be posting like meeting minutes and things. We'll put under what's new or what's happening on the department's homepage, and click directly to the minutes from the meeting, the presentations, and the citizens that were at the meeting really appreciated that. And then Katie Otanius from the environmental health section talked about the work that we are going to be doing in Hammersley Inlet. the in-house work with the parcel reviews, the actual testing, and we're not only doing water sampling along the shoreline, but we're doing some optical brightener sampling. And it's a very, very simple process, but that'll tell us if it's coming from a house where we use laundry detergents with optical brighteners, and there are certain things that we use in our everyday life that'll show up in those optical brighteners. But it's you use bamboo rods, just sticks, with cotton sanitary napkins that are in the water. Then once you collect them, you kind of squish everything down in a Ziploc bag and check under a black light for the optical brighteners. So inexpensive, so easy, and it's...
Who thought of that?
Yeah. Other counties have used it and said, that tells us whether we need to be looking at septic systems or at animals.
I love it.
Yes, and it's not expensive like a DNA or RNA test, which doesn't tell us anything except...
And optical brighteners is a chemical that's in our laundry detergent?
Yes. Yes, it makes your whites
Whiter.
whiter.
Got
It
it.
makes your colors pop,
Brighter.
It
Okay.
just, yeah. So that was pretty exciting to talk about that work in conjunction with the regular water sampling.
Okay.
We'll be working upstreams again like usual, as well as out on the shorelines in conjunction with Department of Health surveying. And our staff, Katie and Stacy, have been invited to join Department of Health and the folks from the Food and Drug Administration in the boat. They'll each get to go out one day to see the progress of the dye. And I think that is just so good to have them out there seeing what's happening rather than looking at pictures or hearing people talk about it. They'll be able to see and then relay that information on to the citizens.
Mm-hmm.
But we sent out 200 letters to invite people to this meeting, and like I said, we used 109 shares in the city.
So the 200 folk were people along the shoreline, or?
Nope, the whole drainage.
Okay. Wow. And that's, what watershed? Or
Well,
what body
It's
of water?
Hammersley Inlet.
Right, but what,
We have Oakland Bay on one side.
I understand, when you say drainage, so
Mhm.
just areas that drain into there, okay, so not
Everything that
necessarily a
drains into
creek,
Hammersley,
okay.
so it's not a specific boundary that, we've parsed out,
Okay,
but we want to make sure that everybody was involved. The day before the meeting, I was up front, and a gentleman walked in and he said, I want to know about that meeting tomorrow. And so I told him that, it's going to be the kickoff meeting for the work that's going to be done there, mostly starting after the first of the year and what we'd be doing. He says, so you're not going to be yelling at people who don't have their septic system service current? And I said, no, but we'll have information. He said, okay, that's what I need to know. Turned around and walked out. I've never seen him since. So.
He just didn't want to get yelled at.
Well, nobody still didn't show up for the meeting, right?
Nobody knew what was going on, and he took the time to come in and find out.
Hmm.
So we're still hopeful that we will get some formerly named Coordinated Prevention Grant funding, which it's something to local jurisdictions. They're calling it now another set of initials that I haven't quite mastered, for our solid waste work as soon as the legislature reconvenes in January. If not, I'll be back saying, okay, this is what we've got. We've got a half-time person doing solid waste, and the complaints are building up, and she has been so proud of her work and so on top of it. Being able to only work half-time in the program is killing her.
So we fund half an FTE with that money?
Roughly with our permits for the exempt facilities and the tipping fee that we get from the utility, the transfer station.
And then the other half comes from the grant, consolidated grant?
Mhm. Basically, we have to have a 25% match, and they pay 75%.
Okay.
But because of our other fees and stuff, we're about 50/50,
Okay. Mm.
which keeps one full-time person.
Mhm.
So something to think about going into the new year. For this group that we have working in the environmental health section right now is a bunch of really top-notch young people. They have technical expertise. They're, getting some of that historical knowledge under their belts and learning the community. And I think the citizens are really appreciating that fresh approach.
Great.
So, Happy New Year!
So, Lydia.
So I submitted to you all my October-November report, kind of what's happening in all the different programs and people. And one of the biggest thing happening right now is, of course, my shift in staff. I should have brought my new nurse over, but she's kind of slammed right now with learning so much. So Vicki, our communicable disease nurse, left on Friday, was her last day. And Audrey started on Thursday. She's our maternal child health nurse. But since we cross-train all of our nurses in communicable disease as well, we said, well, guess what? You're going to get to do communicable disease first to get really good at it, and then you can move into maternal child health. So she is doing some maternal child health things. She's going to different meetings and things with Shannon and Elizabeth to get familiar. And so there's a little cross-training going on there, which is really nice that I have that right now. The ad for the communicable disease nurse will come out on Monday. I have one applicant that reached out to me already, and they had asked prior to the other position about the working back here. It's a former employee that's interested, so at least we have one potential. We'll see when that app comes in and see what else comes in. So being busy with that, of course, three of the four of you were at, oh, you were there too.
We were all
Yeah.
there.
We were all there.
We were all
there last
well
week.
represented.
So, yeah, we
No.
thought it was a great meeting, had good attendance. I don't know how your breakout sessions were. Mine was interesting. It was a little different than I thought was going to happen, but it still had some interesting comments from people in the community in it.
Mine was packed.
Yeah.
We had to get more chairs
And you were concerned.
Yeah.
we literally sat there, me and my co-chair looked at each other and said, nobody's gonna come in, it doesn't look like anybody, but then it just came in, and then we thought, we filled it up. First time we thought that was interesting, then we waited, nobody's gonna come in, and then we had to get extra chairs in the second one.
Well, you were kind of a catch-all,
Yeah.
so,
Yep.
yeah. If you didn't know where else to
Anybody
go.
who wanted to vent, that's where they
Yeah.
went, and they vented, it went well.
That's a conversation from a lot of folks, but I think that these forums were a good start, but I think what didn't happen, that I think is the next step, is for the average person who wants to do something, to be able to provide, this is what you could do. Because there were a lot of folks that it was good for education. It was phenomenal for education about addiction and what that does to you physiologically. And then what are the programs that are more treatment provider type programs. But I think the people that want to be able to help here in the community don't really have a there's normally, you donate here, you volunteer there,
So Kevin, did you feel that way with our last one that we went to? Because
Yeah.
actually, there were some people in that last one that said, what can we do to
Right.
get this
Yeah, I
going?
think-
Same on the walk somewhere as well.
Yeah, I think that's a general, this is great, and I think it is, and, but people, I think, are interested in the
And
action,
moving it
the action
forward.
items.
Yeah.
Mhm.
So that kind of helps us as public health to know where we may want to gear some public information on the website. Right now, we've been trying to set up, working with both Todd in housing and then in prevention and aid in the opioid response, kind of creating a better word, just creating what does it all look like and where can people go and what's needed and where are the gaps. So we've been working on that for about a month. And to try to decide we did hire for our new community health educator position, which is a perfect opportunity here to do that with the communities. So we're going to bring her in on it. Her name is Allison. She starts on December 1. And bring her in to begin to think about how can we do that, reach out to the public to figure out where can we direct them, where are their questions, where do they want to go. So we'll try to gear the website up that way maybe that might be an idea, is to give people an opportunity. That was originally our plan, but it never happened through this matters. So I think maybe we as public health will create something so that people can be driven to it. I know with the brochure we've done for opioid, Abe's phone is ringing off the hook. So he gets asked very direct questions about things from both those people who are needing treatment or users and family members. A lot of family call him asking for resources, what can I do, where can I go? And I think we've also determined that it's lacking support for families, family support. That's the other area that we've seen a couple of times now. It seems to be lacking. So. Yeah, but I think we heard a lot of things. It was nice to see the community turn out and be interested. We talked to schools. I talked to a lot of school people came up and were talking to me, asking about this. So we've now directed Abe out there, and he's also, and that might be also another piece. He's got 3 or 4, including the Comish tribe meetings going on already. They invited him out to come out and speak to the community. So.
We had some results in mind, a little different, but Lieutenant Drackley was there. I offered him to be part of the panel. And so we were able to put some people together that were trying to figure out what to do in their community, how to handle it, how things weren't being handled. We also there was a separation between law enforcement and the providers of the services, and we were able to get past and put some connections there as well. It was very beneficial all the way around by the time it was over.
I was impressed. I saw both fire and law enforcement really working together and going into the schools and saying, well, we'll set you up over here. I saw that in a couple of the farms that I was in. Very awesome.
And I had Todd in ours, and so he helped, facilitate on behalf of the county. It actually worked really well.
Yeah, and I thought Joni had made some good connections for the drug and alcohol counseling part of it for the schools. So.
Yeah, I thought it was great. Your staff presence there was wonderful, and certainly hats off to them. One of the things that I think would be helpful is knowing now that we have all the different agencies that have Narcan on board, kind of hearing a little bit about how that's being utilized, or the rate at which they're having to use it, and because I know they probably have to come back to Abe or for resupply and things like that. So I would just be curious to know.
Yeah, if you can those numbers,
Yeah.
and we get a report out.
It's a reportable incident, isn't
It's
it
not
now?
portable,
that's true.
But there was some confusion with our EMS system, and we knew it had been there. Dr. Yu had been trying to work on it, but we think, Abe thinks he made a couple of connections that now we seem to be in the right path.
Mhm.
And frankly, Bo was one of those connections.
Right.
Which really helped to say, okay, there was misunderstanding about that they didn't take them into the hospital and things like that. So I think we're clarifying. And that was one of our lists of things that we needed to attend to, is figure out why we weren't hearing back for how often it was being used out in the field. And then we're trying, because we do have something set up for people to give a mechanism back and use it on their own. That still needs a lot of work, but that's that building that trust with the community that's using. And that's just going to take time. By the time people get to know the program's there and that the law enforcement are working with us and the EMS is working with us, and they feel less fear about 'cause a
Being
bunch of questions
arrested
came up
for.
about being arrested. Yeah.
So now that kind of triggers me to ask, would you be able to report that under this part of your communicable disease
Oh,
and
yes. Mhm.
notify them to?
Actually, I do
condition?
have an opioid column in here, opioid overdose program on page 3.
Uh-huh.
So that's what we're reporting, but we can make sure that we add that in.
Into
We have to do a report to DOH monthly, and now to our new people, we do it quarterly. So there's lots of reports, lots of numbers. Vicki set up a wonderful
But
spreadsheet.
it's the distribution of them. So this would be where you would,
We would add it here.
okay, so we haven't gotten any kind of reporting back yet.
Yes, we have reported, but we haven't necessarily, so we put in a report to the state and they compile things, but he hasn't been putting it in here, but we can put it in here
Okay.
as to what we're getting back. We were not getting a lot back was a problem.
Right.
So I
Okay.
think we might have rectified that.
Okay.
Did any of you guys attend the Narcan one?
I do.
No, I didn't.
Was people going into it, before they were going into it, were really trying to figure out how to get access, you know, what's the easiest way, and then even afterwards, there was a lot of people with how to get access. And the idea that Peninsula is willing to, any patient out there, so just give them the stuff. But then how do we make it so that we can get it from Safeway and get it at a reasonable price, because the mist was so much more expensive than the other, but there's a kit you put together to make a mist,
Yeah.
is what they're saying. But I'd like to see us do a little more education on that, on teaching these people how to get it and how to use it, because after talking to some of them, I believe that it's one of those things that if you have a relative that's doing it, if you have the neighbor that's doing it, might as well have it at your ready if you can get it.
So it's free. They just need to attend AIDS workshop. And so we did make that clear. I didn't attend the first Narcan, I attended the second, and I cleared that up in the second one because I think the guys that were sharing didn't
Yeah,
understand that.
they didn't know that, because they spread the word differently than that.
Yeah, they didn't understand it. There was confusion in the north end, and we're not
So
exactly
we
sure.
can put on, the next time, we could actually put on a class and
Yeah.
have Abe come and do it, and then they can get them.
As a matter of fact, that night, they set up a date for a class. I don't know when it is.
How many
but,
do you have to give out?
We can get as many as we need. Yeah, we're replenishing, we've replenished, I think, 3 or 4 times. So we
That's a lot.
started first with law enforcement and EMS. We wanted to make sure they were covered first, and so we did them. Then he's been handing out regularly every month over here, and now when he goes to, like he's going to the tribe, he's going to take kits with them. We just have to know approximately how many people are going to come, because we have to order them in.
Well, that's a sellable attribute, trying
Yes.
to get more people
Yes.
to attend and actually, you know, they want a purpose, as we said before, they want something, that's huge.
So before we left that night, they made some arrangements, they went and met with Abe, because I told him Abe's the one you need to connect with, he's available, and so my understanding is they've set up the date already, and found the location that we're gonna have it, so we haven't gotten the details.
That's great.
Yeah. So it was successful in that respect, and I think just having the forum, again, raised more awareness to people that weren't aware, and now, like I said, we have gone through 700 brochures in the last 3 months.
Yeah, I know a lot of people took
And we
them
just
that
wanted to
night.
find
Well,
people.
I was surprised with how many of them, it wasn't just one person said it, how many said we need to do this again and again?
Yes.
Obviously, they're always using somebody else as an example, but the truth is, they're saying, I want more information, I couldn't get enough of this, I need to do this again, I need to get some more.
Well, I think a lot of people that came were surprised that it was more informational and not like shame on you.
Yeah.
I mean, it wasn't,
Yeah.
it wasn't saying, oh, we can't have opioids in our community. They're already there, and it was more informational. And I think that that's what they liked about it.
Well, that doctor knocked me out, I dug him a lot.
He's awesome.
I appreciated the one we did down south, but that was very much more the emotional, I'm a survivor of it, this is what I did. This one was numbers and stats, and I was, so having listened to it, taking it all in, going, oh, I didn't know that, now I do. That
Yeah.
was pretty huge.
Was supposed to be at our other forum,
Oh, was
he
it?
ended up in the hospital.
Oh, dear.
So that's why we went after him for this one and asked him to come, which I was excited. I think he struggled a little bit. The venue was a little large, and because he was late, I think he struggled to run a little faster. He has wonderful presentations, so we're going to be getting them because we need access, and we're hoping to put them on our website so that people can go there and watch a video of 20 minutes and learn a whole lot.
Well, I picked something else up. I just watched a movie with my family called Chips, and there was a line in there I wouldn't have gotten before when they were asking whether or not he had a drug problem, but with painful opioids. And his question was, well, how many times do you go to the bathroom? Once a day, once a week, once a month? Then I got that. I wouldn't have got that before.
So anyway, glad you all were there, and it turned out so well. It was exciting, and I think hats off to Bo, because he worked very hard on doing it, and I thought he did a
Good
great
man.
job.
Yeah.
And he made more connections with EMS for us, which is something we really did need more of, so it was good. And, yeah, everything else, there's lots of fun things happening, kind of crazy, but it always is. So,
Okay. So, other business and board discussion?
Just wanted to bring up one thing. Dave had mentioned that and asked me to bring up the Tobacco 21 conversation that's happening in Olympia. I think it's premature to have the conversation now, given the full board isn't here, and Dr. Yu isn't here, but I think that he was interested in us having a conversation about that today, but I think it'd be more prudent to have that conversation when we meet after the new year.
Anything else? And our public just left. So, motion to adjourn?
So moved.
I'll second.
Okay, we are adjourned. Okay.
I think Randy chaired it.